everyone, it's Linda McKenna from Golden Rules Senior Placement Services coming to you today with Tuesday Talks. Well, it is June 30th, and yes, it's the last day of the month, but we're not going to leave this month without talking about osteoporosis, because June is osteoporosis month, and we want to talk about it, especially that affects our senior population. So the topic, yes, is osteoporosis, and we're going to discuss what means of comfort and activities can our senior loved ones participate in with this disease. It doesn't come at any age, but honestly, as you grow older, yes, osteoporosis is a great contributor to the aging process. National Osteoporosis Month is marked throughout June every year. It is a special awareness month that makes it easier for people to find out about the critical importance of good bone health and osteoporosis prevention. Did you know that hundreds of millions of people in the world suffer from osteoporosis and low bone density? In fact, approximately 10 million Americans have osteoporosis, and more than 44 million have low bone density, placing them at increased risk of osteoporosis. What exactly is osteoporosis? How can we prevent it? Is there any remedy for people suffering from this disease? Let's get into the details. The history of National Osteoporosis Month actually started when it was recognized that bone disease was recognized by a brittle weakness of the bones, and is also called the silent disease because you cannot feel your bones getting weaker. In fact, you might not even know you have osteoporosis until after you break a bone. It was in the United Kingdom. June is officially observed as National Osteoporosis Month. The Osteoporosis Month program was aimed to generate awareness, to inspire behavioral changes, to keep the bones healthy. Although human bone density reduces with age, contrary to what people think, osteoporosis is a normal symptom of aging. It is not normal at any stage at life. It can cause serious broken bones, pain, suffering, life-altering loss of mobility, and even death. It has reached a peak as far as bone mass between the ages of 25 and 30. And that's when we slowly start losing the bone mass at age 40. So this is why you want to be aware of it. Even you, maybe as the caregiver, realize that you are doing a lot of things for your senior loved one at home, and you could compromise your body with especially bone density if you're picking and lifting and doing all that as well too. So making you aware that you need to be just as healthy as your senior loved one. So the month of osteoporosis, what is the frequently asked questions? What is the main cause of osteoporosis in women? For women, it is main cause of osteoporosis is bone loss due to the drop in the body's estrogen levels. Menopause is the most trigger for estrogen loss in women. What are some of the early signs of osteoporosis? The most common early warning signs of osteoporosis are receding gums, decreased grip strength, cramps, bone pain, fracture, loss of height, and brittle fingernails. What does osteoporosis feel like? You may experience severe back pain that gets worse when you are standing or walking. Lying down gives some level of comfort and relief, but has anything that involves twisting or bending your body will be painful. 5 serious facts about osteoporosis you need to know. 1, men are ahead. Men have 10-year head start over women in terms of their bone health. 2, ethnicity plays a role. Osteoporosis occurs mostly in Caucasian and Asian women. 3, quit smoking can help. Quit smoking can help reduce your risk of osteoporosis. 4, costs a lot. The osteoporosis medications and hospitalization could sum up to 19 billion annually. 5, sneezing can be serious. People with osteoporosis can break a bone from a simple action like sneezing. Why National Osteoporosis Month is important. We need this awareness, period. The core aim of the National Osteoporosis Month is to improve the quality of life by preventing low bone density. It also supports people who are suffering from the disease. 2, many people work together on this. The success of National Osteoporosis Month is possible due to activities of dedicated volunteers, health professionals, staff, and cooperative people. It's time to get involved. 3, healthy bones, healthy life. With millions of people suffering from osteoporosis, National Osteoporosis Month is a great way to learn how to maintain healthy bones. Knowledge is power. How to observe National Osteoporosis Month. 1, start a fundraiser. A place to start when marking National Osteoporosis Month is by hosting a fundraiser event, identifying relevant organizations to fund, and with their permission, plan an event to help them raise funds for research to help osteoporosis patients pay their medical bills. Invite your friends, family, and network to attend. Make donations and support the events. 2, contribute to the cause. Contribute to the cause in other ways like advocating for improved patient care and support. You may also make hospital visits to cheer up and keep the sick company occupancy, or volunteer at the relevant organizations. 3, share your story. Raise awareness about osteoporosis through your personal experience. By sharing your journey, you can help others tackle their own difficulties. And now the activities and comfort is support groups for our senior loved ones. And in senior living, this is where there is an advantage of what senior living. A lot of them are experiencing osteoporosis, so there's low impact exercise that they do, stretching, something that they do as a group within the senior living, assisted living communities. And it's something that if you keep active every day, it is important. Sitting just for long periods of time is not good. Some mild form of exercise is wonderful. As the old saying says, if you don't use it, you lose it. So mobility can be really altered and also decline from it because of the lack of movement. And realize there's oversight within senior living, that somebody is watching over somebody doing the exercise, so it's not overly strenuous for each individual, depending on where they are on their journey. So, activities are important, as well as going to the doctor on a regular basis and maintaining their watchful eye, but also going for bone density tests frequently at your most local imaging center as well, too, to see that. So with all further ado, this is why we gather together and actually talk about subjects that sometimes are very tender to our heart. I know I have osteoporosis in my family, and I am subject to it as well. So you do learn from each other and support one another. So let's talk about topics that we can help one another with. As always, I lead you to my website, which is www.goldenruleseniorplacement.com. There you will find my demographics to get in touch with me. Also, my bio, testimonials, various options on senior living, resources, and libraries of not only Tuesday Talks, but now we have wonderful Old Wednesday, which we call WOW, and Words of Wisdom. So to have you get acquainted with some of the topics that we have spoken in the past over the last 8 years for Tuesday Talks, and now the last year we've been doing Wonderful Wednesday. So looking on to July, what are we going to be talking about for Tuesday Talks? So next Tuesday Tuesday will be July 7th, and it is National Family Reunion Month. What thoughts, suggestions, and great creative ideas can we plan a family reunion with our senior loved ones too? And tomorrow, July 1st, we start the month of July, where for WOW, which is Words of Wisdom on Wonderful Old Wednesday, we're going to be talking about, besides July 4th, Patriotic Day, July is National Grilling, Hot Dogs, Baked Beans, Watermelon, and Picnic Month. So how can we celebrate these summer fun days of recognition with our senior loved ones too? So thank you so much for viewing Tuesday Talks. And like I said, there's very sensitive matters. If there's something or a topic that you would like to discuss, please shoot me a line via text, also by email, and I will get work on it and making sure that I can present it to you all. Thank you again. Have a blessed day. See you tomorrow for WOW, and another blessed week till I see you next week for Tuesday Talks. Thank you so much. Bye-bye now.